Donald Trump has put on a show of strength for his supporters with a surprise drive-by in his motorcade outside the hospital where he's being treated for COVID-19. The US president says he's learned a lot about the virus and understands it. Mr Trump's doctors hope they can discharge him in a day after he was treated with a steroid that's only recommended in severe cases. North America correspondent David Lipson begins our coverage.
Even COVID-19 can't keep Donald Trump away from his fans. His motorcade drove out of hospital, a masked president inside, along with his security detail.
God bless our president! I will die for him! I will die for that man!
Waving to jubilant supporters as he rolled down the road and back into the Walter Reed facility.
Well, that is true to form Donald Trump, and probably the best sign that he's doing quite well, a drive-by for all of his fans gathered here outside the hospital.
Minutes earlier, he posted this video from inside the presidential suite.
We have enthusiasm like probably nobody's ever had. Our people that love the job we're doing, we have more enthusiasm than maybe anybody.
And suggested he's only now getting a full understanding of the virus that's killed 210,000 of his countrymen.
It's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it.
Despite the display of strength, it's becoming clear this isn't a mild case of COVID-19. The president's doctors have revealed they're trying out a third treatment in as many days.
Over the course of his illness, the president has experienced 2 episodes of transient drops in his oxygen saturation.
The latest drug is dexamethasone, a common steroid that's meant to reduce inflammation of the lungs and calm the body's immune response. The World Health Organization advises its use for COVID-19 should be limited to severe or critical cases. His medical team won't describe the condition of the president's lungs, but they remain optimistic.
If he continues to look and feel as well as he does today, our hope is that we can plan for a discharge as early as tomorrow to the White House where he can continue his treatment course.
There was also an attempt to clean up yesterday's chicanery. Doctors revealing their claim the president hadn't been given oxygen the previous day was untrue.
I was trying to reflect the upbeat attitude that the team, the president, that his course of illness has had.
When you're treating a patient, you want to project confidence, you want to lift their spirits, and that was his intent.
Pray for our president!
If the president is discharged from hospital soon, these fans will be waiting for him on the campaign trail. David Lipson, ABC News, Maryland.
And David Lipson joins us from outside the Walter Reed Hospital. David, the doctors say the president could be discharged soon. What are the chances of that happening?
Juanita, he's on the drug remdesivir, which is a 5-day course. It's meant to be administered from hospital, and tomorrow's only day 3. He's also on this steroid that suggests that his case of COVID-19 is more serious than the doctors were originally letting on. But the doctors may just be throwing every treatment they have at their disposal at the president because he is the president and they want him well as soon as possible. And he's clearly not bedridden. He showed that yesterday with that motorcade down the street behind me. And they can probably set up the White House to a point where he would be receiving care not that different to what he'd get in hospital. So taking all that into account, I think he's probably got a better than even chance of being discharged from hospital today, assuming his condition continues to improve.
And what's been the reaction to Mr Trump's drive-by appearance outside the hospital?
Well, like everything with this president, it depends on which side of the fence you stand. His supporters love the fact that he got out of his sickbed and showed his love for them and did the drive-by, showed how strong he is as a leader. They thought it was wonderful. Everyone else thought it was highly irresponsible, and you've had quite a number of doctors pointing out that the staff, the security detail in a hermetically sealed car with him really wouldn't have had a choice but to be there if the president wanted to do this, and that they should quarantine for 2 weeks. They might in fact contract a deadly virus despite the precautions that were taken for their safety. And more broadly, people have been very critical of the example that this sets for a country that's already lost 210,000 citizens to COVID-19. You've had people who have lost loved ones pointing out that they had to say goodbye to them via iPads, and this has only added to the pain that they have been feeling this year.
David Lipson reporting there. The president's diagnosis has done little to change behaviour across America, even as the virus continues to spread at worrying levels. The country is recording more than 40,000 cases a day, a number that's grown in recent weeks. And hundreds of Americans are still dying from the disease every day. New York has had to shut down schools again, as well as non-essential businesses. But 26 states have reopened and now have few or no restrictions. North America correspondent Catherine Diss reports.
If it weren't for the face masks, you wouldn't think this country was gripped by a pandemic. While the nation's leader has been struck down by the virus, which has now claimed more than 200,000 American lives, some still don't believe precautions are necessary.
Thousands of people who've come in contact with him, no masks, and so it flies in the face of everything we're told. He should have been sick a long time ago.
Slaves wear masks. I don't wear a mask. I'm free.
In New York, it's back to square one. Just weeks after falling infections paved the way for schools to reopen and indoor dining to return, parts of the Big Apple are back under lockdown.
We can stop this from being a quote-unquote second wave.
But many of the hardest hit states have removed restrictions, with the widespread support of residents.
99.9% survive, so President will prove this.
It's not really that big of a deal.
Florida has suffered almost 10% of the nation's deaths, and yet it's fully reopened bars and restaurants, which are now operating at capacity. After peaking in July, cases started falling across the country, but since mid-September they've been climbing again as the virus hits areas that had been largely untouched. And as winter approaches, there are fears of an infection onslaught.
Instead of having this sort of outdoor dining, it's going to be colder and people are going to want to go inside, so I think the cases will certainly rise.
I know from my own experience that coronavirus is easy to get. Despite wearing a mask and keeping my distance, I caught COVID-19 after travelling for Donald Trump's Tulsa rally in June. I was lucky enough to recover, but it affected me for weeks. I was tired, nauseous, and my heart rate was pounding. This virus is easy to get and just as hard to recover from.
Every day, more than 40,000 new cases are being reported here, 7.3 million and counting. Catherine Diss, ABC News, Washington.